Technology Officer at Validic. Validic is healthcare's leading digital health platform for connecting patient-generated data with digital health apps, wearables, and in-home medical devices. I'm joined here today with three of our clients who are truly innovative leaders in the digital health space. So we have a cross-section of healthcare represented here from pharma, wellness, and healthcare IT. With, to my left here, John Reites from Quintiles. We have Gillian, Christie from Validic Group, and then Reites from Proteus. So I want to kind of quickly set the stage, and then we'll jump into introduction and conversations. So we are going to hear from each of the panelists, and what we're going to talk about is just practical and successful use cases for using digital health data. So this is digital health data in action. And what we're going to look at is looking at care delivery models, clinical trial models, and incentive programs. And then we're going to tackle some of the biggest challenges that we see in healthcare today, whether it's limited data access, standards, regulatory hurdles, that type of thing. And then finally, we're going to end the session with just a sneak peek at the future of connected health and how technology can really revolutionize patient and provider experiences. So with that, I'm going to jump into introductions. So to my left here is John Reites. John Reites is with Quintiles, and Quintiles is the world's largest provider of product development and integrated healthcare services. They conduct operations in approximately 100 countries. Quintiles is a member of the Fortune 500 and has been named to Fortune lists of the most admired companies. John Reites provided oversight and development for Quintiles patient communities, including Mediguard.org and clinicalresearch.com. John also designed and implemented innovative study design approaches and built new business units from startup to global scale within Quintiles. And as head of digital health acceleration, which is a very awesome title, John focuses on partnering and executing digital health innovation programs with biopharmaceutical companies, established vendors, startups, and VC firms. To his left, we have Gillian Christie from the Validic Group. And Gillian is a health innovation analyst at Validic, where she focuses on the potential of technology to promote health and wellness as related to ethical, legal, and social concerns associated with their use and uptake. She's originally from Canada, and she completed her master's degree at the University of Cambridge in the UK before joining Validic. So welcome, Gillian. And finally, we have Reites from Proteus, very cool company. The Proteus platform combines the latest in technology innovation with decades of healthcare expertise and a unique approach to data analytics. It's a proven platform. It's based on an ingestible sensor it's an ingestible sensor-enabled pill and a wearable patch that unlocks comprehensive data about medication adherence, clinical effectiveness, and empowers more meaningful relationships between patients and caregivers. Proteus delivers actionable insights about healthcare populations, and Ray is head of product management at Proteus and has led the launch of the company's first digital medicine offering in 2015, which is called Proteus Discover. Proteus Discover offers an innovative digital approach to improving health outcomes of patients with uncontrolled comorbid hypertension. And for those of you who haven't seen Proteus, it's very cool. My layman's understanding is that it's an ingestible pill that works kind of like a potato clock, powered by the enzymes in your stomach. Really cool stuff. So let's start just by finding out what each organization is doing a little bit more in the area of digital health. I'm going to start with John Reites. And John, tell us, what are some of the biggest initiatives you have going on right now at Quintiles?
Sure, yeah. There's a lot going on at Quintiles. I mean, if you think about what we're doing as a company, being a provider of clinical research and also helping our customers to commercialize products, we see digital health all the time. I think what's really been really interesting and really neat in the last few years is the change in what digital health means. Digital health now looks more like mHealth. Now there's better apps, there's better wearables, there's more outcome-generated based devices. So we're really, as our customers need us to, we're putting these into research programs. And so, the real value we're trying to provide to customers is really about not just saying, hey, here's a really great device that gets this data you really need, but you got to put it in and you got to plan for it, and you got to write it in your protocol, and you got to consent patients differently, and you got to. So in research, it's a complicated, complex process. It's not as easy as I just put a band on you and move on. It's really complex, and so we have to walk customers through that. Actually, I'll tell you, we've spent a lot of time lately getting sort of helping people to understand not to use a wearable, because it actually doesn't provide them the outcome they're looking for. It may be really cool, it may be something you really want to use, but it doesn't necessarily mean that it gives them the data that they want. And so there's two initiatives that I've been a part of recently that we're really excited about. One is the work we've been doing with Apple's Research Kit. And so we have gone really deep with the company and spent a lot of time enhancing Research Kit as a source code framework. And we launched actually two big features. One is it actually now has a caregiver implementation in it, which means that you can use Research Kit, connect other phones, and connect caregivers in, which is something that it previously didn't have. We're seeing a lot of success with that. And then the second thing we've done is we put in some what we call patient support tools. And these patient support tools are really things that help like reduce wandering or actually do digital reimbursement so they can just have their Apple Pay reimbursed on the phone. So just really helping that experience to work well. And then, as you alluded to, spending a lot of time in wearables. And those wearables really on that map of consumer and sort of these medically approved devices, which both really have very different use cases and have different scenarios where they work well or don't work well, depending on the condition and the type of study. So that's a little bit about what we're doing, but we're excited about it. It's something we have to do. We see the movement, and it's really about, again, helping to make the best decision and picking the right device or the right app that gets you the outcomes you're looking for. It's really critical.
That's great, thanks. We'll talk about some of those use cases here. Yeah, Gillian.
Sure, so I'm going to speak a little bit about Vitality and what we're doing, particularly in the corporate wellness markets. And probably the best analogy that I can give to Vitality is it's a bit like frequent flyer miles, but for your health. So as you engage in healthy activities, you accumulate points. And over time, you can redeem your points for various rewards. So anything from discounted airlines and hotels to purchasing anything off Amazon. And of course, through all of this, you then receive lower life insurance premiums, health insurance premiums. And so we're very much focused on bringing together the sort of actuarial science combined with behavioral economics, rewards, incentives, and then, of course, a major piece of that is technology. So wearables, smartwatches, you name it. And so part of what we do is pull data from devices that our members use and then incentivize them to engage in the healthier activity. So we're very much focused on the health promotion, chronic disease prevention space. We're not focused on sort of the doctor and the hospital setting. It's very much focused on what happens to you up until you enter the hospital. What can you do to improve your health each and every day, as opposed to what can we do to treat you further down the line. So that's a little bit in terms of Vitality. Obviously, there's a very strong technology component included in that.
Great, thanks. And Ray, how about you, Proteus?
Yeah, sure. So, as you mentioned, we launched Discover last year, and so where we are now is we're working with our health system customers to deploy it to their patients that are most in need. So, these are the patients that traditional medicine has not worked for them, and so they're getting this sort of first-in-class digital medicine that combines the measurement, the molecule, the feedback, and the behavioral tools that are sort of encompassed by the Proteus offering. And so, when we talk about the digital medicines, right, the digital part is, data is the backbone of the digital part, and when we think about that, it's not just sort of any data, and it's actually not even big data, because when you're talking at the level of individual patients, it's really about good data. So when we think about good data at a patient level, we're really talking about how are we collecting both the behavioral data of what they're doing, as well as a lot of this outcome data, right, related to their health, in a way that, ideally would just be effortless, would be instant and accurate. I mean, that's sort of the dream. So, the technology that we built, the adjustable sensor and the wearable sensor you mentioned, are really about having to capture a lot of what the patient is doing, right? The act of taking a pill, or walking, resting, heart rate, etc. And so we're capturing a lot of that data in a way that really requires nothing more of the patient than to, put on a wearable sensor, a patch once a week. And then on the outcome data, that's where we work with people like Validic, right? And really bring in that patient-reported data around weight or blood pressure or blood glucose. And so what we find is that just, when you combine this, the behavioral data and the outcome data, and you present this to the patient and you show them this cause and effect, there's this really powerful way of driving patient engagement. And we see, the effect of that engagement when we look at the analytics and the application, when we look at the outcome data, and when we look at, the net promoter scores actually after they're done using our offering. It's really powerful. And then when you sort of flip over to the physician side of things, good data really is what enables timely and personalized clinical interventions. This is because for the first time, the physicians have concrete data to answer very specific questions about what patients are actually doing. And they're just going to have much better conversations because they're going to spend less time assessing what's going on and more time treating the patient. They're going to be able to, for the first time, distinguish between sort of non-response and non-adherence. And so when you kind of combine, the fidelity and the granularity of the data physicians have, now with sort of the engagement you got on the patient side, you start to see how digital medicine can be a pretty effective way to help treat patients to goal. So we're really excited about the work we're doing right now about putting sort of a new tool into the physician's hands and really working with them about how do you, get the most out of the good data from digital medicine.
Yeah, awesome, thanks. Yeah, no, that 360-degree view is really critical, absolutely. Gillian, I'd love to turn to you and ask, how is the incorporation of digital health data going to advance over the next several years from a healthcare and wellness perspective? How do you see this data becoming more integrated and influential for clinical trials, health IT solutions, care treatment, and wellness programs?
Yeah, no, for sure. So I think, particularly from a wellness perspective, what really excites me is just the sheer amount of data to begin with that's emerging on the health promotion, chronic disease prevention side that we haven't really been able to track before. And so thinking about how we can take this newfound data and analyze it to better understand trends across an entire population, as well as trends within a specific individual. So thinking about how the data can be used from almost a research perspective to demonstrate what does work and what doesn't work in health promotion and chronic disease prevention. So I'm really excited by the applications that there are from a research and an evidence and a science perspective to help us inform how we, or what strategies there are to improve our health. So I think from my perspective, that's very much what I'd focus on, is both the amount of the data as well as the analytics associated with it to better understand strategies out there to improve our health.
Yeah, and I would just kind of build on that because I think we think about it very similarly in the sense of good data, as I was describing, is really just kind of the stepping stone to big data, right? And a lot of, obviously, when we're talking to our health system customers, it's about population management. And so, what we're looking forward to, right, is as more and more patients are being helped on an individual basis, your ability to start to aggregate this data and look at it from a population perspective is going to be really powerful in helping to derive, what will effectively be, predictive analytics and models about helping to take entire patient populations and risk stratify them and really find out what is the appropriate treatment for particular populations and then kind of track them over time. So really, I think as this goes forward, you're going to hear more and more about what is happening at the population level, which is top of mind for any health system we talk to.
Yeah, and I kind of think when we think about research and commercialization, in clinical research, you're collecting all this data already, right, from providers, from patients, and all these different data, EMRs, your lab, different data sources. And so wearables is kind of like that extra puzzle piece you get to put in, or in health, and you put it in, and that data you collect, it's actually giving us different signals and different signs and different information. And I'll give you an example. We did this asthma study that was disguised because it was really a sleep study. And we were testing the standard of care that people with asthma get asked questions in an ePro. And in that patient report outcome, they're always asked, how many times, Drew, how many times did you wake up last night because of your asthma exacerbation? And you'd say, oh, 2.
Yeah.
2, and we put biosensors and different forms of wearables on people, and then after the study was done, we compared the data back to what they were reporting. And I remember this guy, who we called him Andrew. He was a de-identified patient, but we used him as the outlier. And like a majority of the patients in the study, it was 7 times he was waking up every night, but he was telling his doctor 2. And so we learned instantly, and this customer used that exploratory data to say, oh my goodness, there's a whole realm of data we need to be collecting. And so mHealth actually unlocked an understanding about how that drug could be used and potentially how prescribing habits could change. And so I look at that as a way to really change. And again, that wasn't because of just that niche. It was actually looking at that big data. So Quintiles really processing and looking end to end and saying, there's a signal, there's a signal. So I think signaling is something we should really think about with these wearables. The other thing I'd say is integration. I know that's like the buzzword today. I've heard it a lot. But when I say integration, I really mean, I think the future is leading to, and we're doing a lot of it today, where that mHealth of that wearable just looks natural. Maybe that's the better word, it's natural. It's not like I'm in the study and I'm having this wearable, or I'm in the study and I gotta go to this app. The UIs and UX is the same, the branding is the same. Very simplistic things. When they go to the doctor, they look at their EMR, they connect the data on the mHealth, it all looks the same. It all looks like it's from that study or that experience. And I think that's really where we see companies like Disney and Target and everybody going. And we have to remember that we have consumers now. These are not patients, they're consumers. And they're saying, well, why is this app so crappy, but my Disney Experience app is awesome, right? And so they're comparing us to that. So I think this is an opportunity for healthcare to up its game, really in this experiential mode of using mHealth and wearables as that front-end UI and UX that can actually really make the integration of data look really good. So I'm excited about that. I think it's good.
Yeah, absolutely. I totally agree. In fact, that's one of the things I'm most excited about with the large players like Apple and Google and Samsung and Microsoft jumping into the space is that, by and large, these are consumer electronics companies, and they've nailed the user experience, which is something that, frankly, we in healthcare have never done a particularly good job of. So I think there's certainly some learning that we can take. Great. So I'd like to turn to you. Maybe Ray, you can start us here. Is just talk through what are some of the biggest challenges and obstacles you see to digital health adoption today? It's this data access issues, regulatory issues, standards issues, limited data types. What are you sort of seeing as the biggest hurdles today?
Sure. I mean, from our perspective, now that working with these health system partners, it's really about actually being pretty disciplined about where we start and actually starting small. But not pilots that way, because these are all kind of commercial implementations, but it's really picking a group to start with and then really looking to expand from that. One of the blessings and the curse of being a digital health platform is that you can imagine a lot of things you can do with it, right? And everyone you talk to, you do this or do that. But actually, it's the unfortunate nature of product management is most of what I have to say is really, it's about focusing and about saying no to things. So there's a lot of discipline, actually. The biggest challenge, but honestly, is we know that at work, it's going to be great, but we have to have discipline in order to kind of get it, to see it end-to-end through the system, and for the health system and the patients to be realizing the benefits, right? Being treated the goals, so to see the economic benefits flow through, you can really build from there. So a lot of the challenge is, really kind of working with our partners to kind of help them realize the full capabilities and the advantage of what we're trying to, do for them.
Sort of providing evidence for evidence-based medicine. Yeah, absolutely. Yeah.
Good.
Sure. I think perhaps for Vitality, but also for the industry more broadly, is what we often call the ethical, legal, and social issues associated with the technology. So thinking about both how the technology is used and deployed, but also about the data stemming from the technologies and how that's used in a responsible manner. So particularly on the ethical and legal side, privacy is obviously a huge issue. And that, I think, cuts across, the wellness space, but I assume, a lot of models in the room. And then, particularly on the social side, is thinking about how these technologies move out from really only benefiting the top sort of few who are healthy to underserved populations, around the world. So really thinking about this sort of social considerations and ensuring that the technologies don't exacerbate digital divides. So from my perspective, I think it's really this intermix of the ethical, legal, social considerations.
And, I see there's a lot of challenges in our industry, but I want to, maybe we can talk about some of the ways that we break down those barriers too, because I think people want to hear that. I mean, it's hard enough to be an entrepreneur starting a company. I think it's equally hard to be an entrepreneur and trying to sort of break down the mold of this is how we've done this for a long time. And in clinical research, even commercialization, there's still a lot of principles that we've followed and we have great process and we've done them for so long that this is really a lot of digital health flies in the face. It really hits that really hard. And a couple that stick out for me, to your point about regulatory and ethics, there's 3 additional categories we added to our data last year around digital health. One was global privacy, because of privacy regs, and needing to have global privacy officers globally is a big deal. But there's these 2 extra things we added. One was cultural, so we did cultural surveys and patient insights across the globe to figure out what patients use certain apps versus text versus different methodologies. And then the 4th one is digital enablement. And so we've been doing a lot of research in digital enablement to find how many users, like in Brazil, use Facebook. It's actually a big indicator on how well you get an mHealth app to work and get used in that particular clinical trial. But if you go to a certain other country where Facebook usage is really small, that's actually an indicator that they don't use mobile apps the same way. And so what I'm saying is that there's a lot of sort of different data that we have to look at that's usually different in the consumer world where you're launching country by country. In clinical trials, you're usually launching, like we're doing, 60 countries at one time. And so it's complex. I'd say the other, one of the other big sort of hurdles we need to get over is really this 2-pronged thing. It's perception, and I'd say it's speed. I'll give you this analogy for perception. So I don't know if you know how many, all the talk we hear about companies like Uber, I don't know if you know how many users actually used Uber. There's a data that came out around December, it said about 8 million people use Uber. Like for all we hear about it, it's really about 8 million people. I don't know if you know, but 2 million people, and this is December data, still use AOL dial-up. Okay? So what we're saying is innovation is really tough and it takes time. And you've got these laggers and early adopters, but actually the space that we're in research and commercialization is everybody in the middle. That's the people we need to influence. And so I actually think it's up to people like us in this room, actually to be very entrepreneurial in our companies. And to really say, this is something we need to test and try, and I put a process around it. Here's how I'm going to de-risk this situation. I think it's really critical. And then speed. I think traditionally we've been relatively slow to adopt. We did a study, I talked about the biosensor. By the time it ended, 2 new versions of it came out. So it was, we were slow. And one of the things we did in starting this group around digital health acceleration is to look at all of some projects around digital health like accelerators with VC firms do. So we put things into a sort of off-site 90-day incubator mode, and we go and we get out that MVP, and then we bring that back into the company or with that customer or with that startup. And so we've seen some really early success with that, but again, trying to get fast. And I think fast is something our industry is really going to have to adjust to really mark in the world. I'd love to hear your thoughts on that.
Yeah, no, I think the other thing that I'd just add on to your point particularly, from the cultural perspective, is thinking about age and gender as well in relation to the technology. And so I obviously speak from a female voice, but many of the devices that are coming out are bulky or they're stuff that just I wouldn't particularly wear. So thinking about how we design technology that is gender neutral, as well as technologies that are appropriate for people at different ages of life. So thinking about older populations and how do you design for an older population having bigger flaws that have high contrast in color. So I think the cultural piece certainly is one of it, but the age and gender also I think should definitely be included in there too.
Yeah, absolutely no, and I think that so if I can sort of summarize, John, a little bit of what you're saying on the point of healthcare providers is when you're being an entrepreneur and you're trying to change the business model effectively, you probably should have a really good idea of parameters before you start to know what success looks like, because obviously when you do a small pilot, you're not going to be able to say that this pilot compared to the way we practice medicine for the last 30 years is successful, right? But this pilot potentially at scale, and as we incrementally improve it, could get there. To be
that's a great mention. I mean, that was a great point about you don't really get the luxury of pilot sometimes it's baby steps, right? It's your crawl, walk, run, and I think you're absolutely right, and it's something we have to do, and a lot of times too, it's as simple as really walking through methodology, and you can get that and work with companies that give you that methodology. And we spent the last 6 months writing something that's going to be published in February, hopefully, and that really gives a checklist. It's sort of like a funnel for if you should use that digital health wearable or device. So we're actually not trying to talk people out of it. We're trying to say you need to think through these things, because if you do, you'll make a better decision about what you put on, and then you'll give that its full effect. That's right to what you were saying, I think.
Yeah, absolutely. Great. Well, so we're going to wrap up here in a minute. I just want to say, so from my perspective, I'm actually really glad that none of you have this problem, because you are all customers of ours. One of the biggest problems that I see for digital health adoption is just the fact that getting data from a lot of data sources is a huge challenge. So, we did a market survey and found, this was a couple of years ago, we found that 92% of devices that are in patients' hands today are just not connected. It's a huge problem. We found, patients have blood pressure monitors, they're writing their values in log books and taking them to the doctors. The doctors don't have time, can't analyze it, they don't want to see it. So we actually, at Validic, just today, some of you may have heard of it, launched a new technology to help solve that problem. It's called VitalSnap. I'd really love to show you guys a video of that really quick. Every day, technology is helping us become more connected. Connected to each other, connected to ourselves, connected to the world around us. We share this world with 7.3 billion fellow travelers, each of us with our own hopes, our own dreams, our own needs. Just like everyone needs food and water and shelter, at some point in our lives, everyone needs healthcare. We recognize that about 90% of medical devices that are in the hands of patients with chronic conditions today are actually inaccessible through conventional technology means. So, these are what we consider non-connected devices.
Most people think healthcare really happens at doctor's offices and hospitals, but if you really think about it, the majority of time is actually when you're at home or you're away from the medical setting.
The challenges are a lot of the data that doctors need to make clinical decisions sometimes aren't available. A lot of time is spent trying to get accurate information coming back from patients, especially for chronic patients. Literally seen patients walk in with 3 green binders that they've, have graph paper that they've tried to store things on. Even though there's a lot of devices out there that patients are able to tap into and pull data from, there's still a lot of data that's stuck in these old legacy type devices.
All of these devices almost universally have a screen that displays the number, the readout to the patient. And so I thought, I can deposit a check with my phone by just scanning the check and sending that off to my bank. Why can't I do the same thing with my medical device? Why can't I simply hold my phone over the medical device, quickly grab the number and have that sent to my healthcare provider in order to better manage my chronic condition?
When we heard about VitalSnap, we thought it was a great idea. It lets people continue to use the devices that they're familiar with and give better visibility to their care team of what's happening, even if they don't have a connected device.
The phone is already an incredibly personal item that people feel comfortable with, and we can just allow them to use what they already know to participate in their own healthcare. Simply take a reading as you normally would, open up your phone, pull up the app, hold the app over the device, and instantly the data that's on the screen flows directly to the provider.
It's a lifetime commitment to managing a condition, right? Anything you can do to make that more enjoyable for the patient, and to improve that experience for them, give them back something throughout their day, and still capture that level of information that they know they can give back to their provider is really valuable.
You just want to live your life. You want to be able to spend time with your family, whatever it is that you want to do. You want to really be able to do that without worrying about your health, and you want tracking your health to be easy. I really think in the future that as we get to more value-based care and less dollar in every visit kind of care, that things like this really enable that to happen.
True Connected Health is enabled with VitalSnap because you get all the value from your care team that you would expect from a high-end device, but the ease of usability of really any device you might have.
The promise of this technology to actually be able to provide care to those who need it most is so meaningful. I think we're going to actually be able to engage patients in a way that just hasn't been possible before. So yeah, so we're really excited about that, and our time is up on stage here, but I just want to mention that we will be hosting a session downstairs in the stands at the CTA Member Lounge in room 1 at 4:30 p.m. for any of you who want to come and learn more about VitalSnap in person, see a live demo. And I just want to thank you all for your time. I hope that you gained some valuable insights. Please join me in thanking my fellow panelists here, John, Gillian, Ray. Thank you so much. And we don't have time for questions. I apologize. Yeah, we're coming back there. We'll be back in the back room.